This podcast is sponsored by my counseling practice, Elizabeth Polinsky Counseling, where I offer weekly marriage counseling, weekend-long marriage intensives, and therapist training in emotionally focused couple therapy. To learn more about my marriage counseling services, visit www.elizabethpolinskycounseling.com. Hey everyone, welcome back to the Communicate and Connect podcast for military relationships. This is episode 39, Healing from Trauma While in a Relationship with Karen Robinson. So I'm really excited to have Karen on the podcast today. We've had some trouble getting scheduled. I've been waiting for her for a while, and she's here, so it's awesome. Thank you so much for being here and for going through the scheduling difficulties with me to get here. So,
No, thanks, Liz, so much for having me. I'm really excited to be here with you today, too.
yeah. Do you mind just sharing with our listeners like a little bit about yourself and kind of what you do and your experiences kind of working with trauma?
Sure. So I am a trauma recovery expert, but I'm also a survivor. And that's probably the main reason why I do the work I do is intimately familiar with trauma and the impact trauma can have not only on our personal lives, but in all of our relationships.
Mm.
I grew up in Canada and also Maine. My parents lived near the border. I graduated from the University of Maine with my master's degree over 24 years ago. So I feel like an old dinosaur at this point in my career. Most of my career has been with the Department of Defense as a military therapist and social worker. I've had countless individual and marital sessions, family sessions. I've done a lot of different things with the military. I've worked in the emergency room. I've worked in inpatient mental health, outpatient mental health. I supervise multiple units. At one point, I was supervising 4 different programs, including medical social work, outpatient, inpatient, emergency services for the DoD.
Yeah.
So I hope that answers that question.
Yeah, that's so amazing. Like you have so much wealth of experience with working with like clinically with the DoD and military um, service members and their families in a variety of different settings. So this is kind of exciting. I love having people who are clinicians, therapists, social workers who have sort of that healing profession view, but who also work specifically with military populations. So I'm super stoked. Is there anything else you wanted to add, like in your intro, before we talk more about trauma?
Sure. I am mostly private practice now. I do contract with agencies and I work with a lot of veterans, active duty, still family members. I do coaching and I also do therapy. So anyone that lives in Virginia, I'm available to do therapy. Anyone outside of Virginia, I offer coaching services.
Okay. All right. That's
Yeah.
so great. Yeah. What's your website so people know where to find you?
It's healthrivedream.com.
Okay.
So healthrivedream.com.
Okay. Great. So I know we have covered um, trauma and oftentimes post-traumatic stress disorder, which is a common outcome of going through an experience of trauma, but not always. We've sort of covered symptoms in a previous episode, but I'm hoping you'll give us sort of a little bit of a refresher to get us started. Like what is trauma and how does it impact people?
Sure. So a traumatic event is an adverse event that is disruptive to a human, on an emotional, physical, relational, spiritual way. So the easiest one to start with, not easiest to deal with, but the easiest one to start with, is the symptom of moral injury, which is when an event happens, like if you're at war and trying to make sense out of it afterwards, like what would God think, or being really angry with God, not understanding war and the harder things in life, like why is this happening? So working on moral injuries is huge for people. Emotional injuries end up what we call I think you just did them, the anxiety, depression, post-traumatic stress. This is when we feel really dysregulated. It could also be anger. So there's this concept called the window of tolerance. Most survivors of trauma fall just outside of that, either hypoaroused, where they feel lethargic, fatigued, loss, dissociation. And then above that window is called hyperarousal. This is when we feel really agitated, moody, disgruntled. It feels like we're coming out of our skin. It's panic attack type symptoms
Mm,
with full-fledged anxiety. So the goal for survivors is to learn how to get back into that window of tolerance. And it's really not easy for survivors. It takes a lot of practice. So those are the emotional symptoms. Relational, what tends to get impacted are things like our ability to communicate effectively, our decision making, our ability to handle conflict. And we often lose our just our sense of humor. So working on
yeah.
that in relationships and being playful again is what I notice. I hope I answered that.
Yeah, I think that was a great answer. Do you mind? I'm just going to repeat it. I repeat a lot and it helps me keep things organized in my head. So trauma is sort of like a really bad negative experience, an adverse thing that would be overwhelming to anybody, like every human out there. To like failing a test wouldn't be overwhelming to everybody. So that wouldn't count as a
Right.
trauma. It would have to be something really, like, really intense, big, that for every single human out there, our nervous systems just react to it. And then it has an impact on our sense of self as a moral individual. I would almost tie in like spirituality maybe is like kind of connected to that. And then our emotional self, and then our relationships. And you listed several ways that it could impact each of those three areas. Yeah.
Yeah, the one clarifying point I would probably make is that we individually can still respond to trauma differently. And that's because of genetics or environmental factors. So someone in combat may have a, a more severe reaction if they've had a previous history of being an abused child, or someone with a lot of abandonment issues, or already has depression. Their experience of trauma could be more significant. In fact, the DSM also, now in the DSM-5, back in the day, it was trying to be more objective on how trauma is seen. Now it's a little more subjective. So if the person feels traumatized and has those symptoms, that's what gets treated, whether it's a smaller thing or not to an observer. I hope that makes
Yeah.
sense.
Yes, it does. I think that's an important point that I have heard. I used to be a trauma therapist for the Department of Veterans Affairs before I went into couples counseling. And there were times where someone would come in and they would sort of say, like, well, my trauma wasn't as bad, I'm air quotes right now, as bad as someone else's trauma, and sort of kind of dismiss their experiences or the experiences someone else had gone through. But the way something impacts us is so different. Some people might have a harder time recovering from trauma than someone else, and the symptoms might have a lot of similarities, but some of them might be more strong compared to others. Like I think you
Right.
mentioned it, hypo versus hyper arousal. like which one do I go to, um, might vary from person to person as well. So I'm glad you included that piece because I don't want anyone listening to this episode right now
Hmm.
thinking like, oh, my trauma is somehow not good enough or not big enough compared to someone else's.
Yeah.
So since our podcast is so focused on couples
Hmm.
and obviously military couples, and and so many military members do have experiences of trauma while in the military, I want to talk a little bit more about how that might impact military couples, their relationships, what even like what spouses might be seeing from their partner after their partner's gone through something traumatic. I'm wondering if you might be able to comment a little bit more in depth on some of the ways trauma shows up in military couple relationships.
Yeah, so marriage is already pretty challenging. Having
Yes.
two people with their own separate sets of baggage to come together. So it's like quadruple baggage that we're working on as a maybe quadruple, maybe triple the baggage. So they each have their own separate baggage and then the baggage that comes with trying to negotiate a marriage. It's really a lot of work. And I think calling it something outside of work is maybe not accurate. So if we think of marriage as work that needs attention, just like anything else in our life, that will be helpful. A lot of times we get complacent, we take our relationships for granted, um, and we just get too comfortable with just being not considerate at times or just talking to our spouse like any old way. And so if we can consider our spouse as the person that's supposed to be on our team and we're on their team, if we think of the arrangement as best friends, if you would not say something to your best friend, you probably should not say that to your spouse.
I like
So in
that.
my experience, yes, in my experience, couples that can have fun together go a long way. And I don't mean the partying fun at the bar. I mean, generally enjoy each other's company, enjoy each other's joking around, that lighthearted playfulness quality. And sometimes after trauma, that's really hard.
Mhm.
So, things on an individual level that can help is having your own set of hobbies, your activities that bring down your stress so that you can also play in your marriage. I think that's huge. The other thing I think is really helpful, even if you think you're an awesome, amazing communicator, take a class, go to a workshop. I teach something called communication skills with couples, and it's about a 4 session where I have people stand on maps. The listener has their set of mats, the speaker has their separate set of mats. And so they can practice what it is to be an effective speaker, like
Mhm.
not rambling on and on and on and on and on and then expect your partner to get it all. Like you say what you need in a concise manner, and then the listener is repeating it back, asking for clarification, inviting for more information, is doing the actions, the nonverbals to show they're following along. There's eye contact, right? And so what I noticed with couples is one person's trying to watch TV, one person walks into the room and starts talking. That's not very effective. So if you're having a hard time getting out your message across, there's techniques like touching your partner on the arm, not during their favorite TV show, but just at another time, and saying, could you come in the other room with me for a minute? I really have something I want to talk to you about. And
Mhm.
then another technique I heard about in practice when I was doing marital training is think about what does that person like to eat or drink. So maybe make their favorite beverage, and make them a sandwich because sometimes if an intense conversation that helps them feel like it's almost like their stress toy. having something to fiddle with their hands. It takes the intensity down, just having something to eat, to drink, and then just saying, I really wanted to talk to you about this, and I just need you to listen. Okay.
Mm,
And then saying what you need from your partner. Like, do you need validation? Do you need tangible help? Like, I need you to rent a pickup truck so we can move this stove. It's
mm.
driving me nuts. Or do you need physical affection? I really just need you to hug me. Do you need information? Or do you just need your partner to have your back? Like, I don't want you to give me advice. I want you to hear what I say and tell me that you support me.
I'm following. Do you mind if I pause you and just repeat because it's a lot of information at once, and I'm just trying to grasp it all. So one of the ways that trauma really impacts people is that they can lose their sense of playfulness, which is really important for couples to sort of maintain their best friendship, their friendship aspect, and the playfulness between them. And so then I think then went into here are some ways that, oh, also communication. So it impacts playfulness and communication. And then here are ways to help your partner or help navigate that as a couple when we want to try to like improve communication or improve playfulness. Let me see if I can repeat what you've said so far. You said you sort of teach people to be effective at communicating instead of rambling, being sort of succinct and clear, and
Hmm.
how to focus on listening to their partner. You also mentioned inviting your partner to a conversation versus sort of like I don't know, I sometimes think inflicting, which is harsher than what most people are doing. But helping invite them into a conversation with you versus kind of interrupting whatever they were doing. And then you said like doing something to help make it a positive experience. So can we, like, I love coffee. So for me,
Right.
my partner could give me coffee, and then
Hmm.
that would be a way to like soothe me or butter me up, sweet me into a a good moment to like start this conversation on a good feeling between us. Did I miss one of the ones that you had mentioned?
I don't think so. I think that was pretty
Okay.
succinct.
Okay.
Yeah.
Thanks. Okay. Yeah, I like all of those. Did you have other thoughts on ways that couples can improve their communication when there has been trauma?
Yeah. So I think another important skill is to learning to not learning to learn how to have a conflict, how to resolve
Oh,
conflict. Yes.
how do you teach people how to resolve conflict?
Yes, great question. Because with survivors, emotions can be pretty dysregulated. This is when something really negative or harmful can happen. Anywhere to saying things you don't mean, to domestic
Hmm.
violence or abuse, or somebody leaving, getting into a car accident. So, learning how to handle conflict is huge. And I do have ideas for that. One is if you need to take a time out, simply say that. Say where you're going. It's preferred actually if you can do it in the house and not leave. If you need to leave, it's important to state what time you will be back and that you agree to work on the issue when you return. So, reassuring your partner something like, I love you. I'm really upset. I need to step out to calm myself. I'm going to go to the grocery store, get some snacks for later. And then when we come home, I will let you know when I'm ready to talk again. Okay. So I don't recommend going to the bar if you have
Uh,
a conflict with your spouse, and the person who's receiving the information about the timeout, don't go and block the door. think of it as a healthy separation to make the two of you better when you come back together. Negotiate with each other on the appropriate time to get back together to talk through the conflict. Sometimes it's the next day. Some funny tips for getting past a conflict is you have to hold hands together the whole time you're working it out.
Mm,
Another tip is be naked. It's really hard to be nasty and mean to your partner if you're both naked because it's
yeah.
a vulnerability thing. So I think it's an experiment of what's going to work with you and your partner, but having a lot of grace for each other. If you're both on the same team, if one of you wins an argument, that means the other loses. That's not teamwork. So it needs to be a win-win. The one person needs to feel they could speak what they need to say. The other person feels like they heard it, and then you switch roles. The speaker becomes the listener. So both people say what they need to say and feel heard. And that
Mm,
takes away a lot of conflict just in that itself. You don't have to agree on everything. You just need to feel like you can say what you need to say and feel heard.
yeah. I love that you are talking about this, especially in the context of trauma, because while I could see this being helpful for any couple, like those tips
Mhm,
on conflict, and every couple has to learn how to navigate conflict. Sometimes when I think about trauma, I think about a coffee cup. So I'm gonna hold my coffee cup up so listeners can visually imagine my coffee cup here. and and that like this coffee cup is how much stress I can handle in a day before it just spills over into me being, for me, grumpy and hangry and moody and snappy. For other people, it could be all sorts of different things. But sometimes when I think about trauma, I'm thinking like when I wake up in the morning with my stress cup, if I have trauma, it's already halfway full. And
Yes.
so other things, I overflow my ability, my how much stress I can take. I have less stuff that you can add to my cup because I'm already dealing with the stress from the trauma. And and so with couples, I'm thinking you're really talking about how do we sort of prevent the cup from overflowing? How can, especially when conflict for every couple is so stressful already,
Mhm.
how do we make conflict the least stressful it could be so people aren't overflowing so much? I love your idea of holding hands or being naked or like doing something that is let's try to be in this comfy place together before we have to figure something out.
I love that you say comfy because I think about getting naked. I'm not super comfortable.
Oh yes, well, that's not
That means
comfortable
you're
either.
healthier.
I don't know. I
No.
mean, I think all of us have. I think all of us feel exposed when we're naked. I think that's a
Mhm.
little bit different. Like if I'm holding hands, I think I'm more in a comfy spot.
Connected. Yes.
Yes, or
Yeah.
if we're cuddling or we're hugging each other while we talk or something, that's more comfy. But your naked idea, what that does, I think more is strip the defenses.
Yes. Yes.
It's not comfy.
Literally and figuratively. Yep.
Yeah.
Yes.
So, yeah, that's probably not comfy, but it does put you in a less defensive spot. So,
Yes.
yeah.
Yes.
So I like this around communication. Just because you mentioned playfulness, I find myself thinking, do you have any thoughts on how couples can also increase their playfulness? Since that's such a
Hmm.
huge part of kind of what you're talking about is like trauma sort of robs us of our ability to just relax, have fun, be playful.
Yes. I do. The most common thing I discuss with this with couples is the boundaries around your time.
Hmm.
So I think out of a month, let's say your typical time together is Friday evenings. It doesn't have to be. There's no right or wrong day. So I say take those 4 Fridays, for example, and rotate. So every other Friday is your business meeting where you discuss your communication, any things that need to happen in the household. It's like a CEO meeting that you're having
Hmm.
where you're dividing tasks up, talking about any issues, any child issues, parenting, your in-laws, who needs to take the car for an oil change. The other 2 Fridays, this means a minimum of twice a month. More is always welcome and encouraged. The other 2 Fridays are dates. And one partner plans for one date and the other partner plans for the other. They plan everything from start to finish. So if childcare is needed, they plan that. They plan time, they plan location, and then there's rules around the dates. Rule number one, no problem talk. No,
Hmm.
I need an oil change, or your mother yelled at me on Thursday.
Yeah.
No, the date is fun. It's you can even pretend that you're just meeting your partner. Okay. It's fun to try different activities. So if you've never have gone ice skating before, try that. Mix it up. The dates don't always have to be expensive or extravagant, but spend some time in the date just playing. Maybe it's a wine and art class. I'm sorry, painting and just sipping wine. Maybe it's
Hmm.
going to try gymnastics together and tumbling around. I don't know, just play. Maybe it's running into the waves if you're near a beach. Google is your best friend. I had a couple session yesterday, and the male partner was having a hard time making up for being inconsiderate with his spouse. And he's like, I don't know what to do. So I had him pull out his phone and get into Google. And I said, tell Google to ask Google, how do I show appreciation for my partner?
Hmm.
And he did that and he started reading it. And I said to the his partner, what is that like? Would you love your partner to do some of these things or say some of these things for you? And she goes, oh my gosh. And he goes, it's so simple. It's right on my phone. So you don't have to know all the answers. Ask a friend, ask Google, ask a therapist, ask a teacher,
Yeah.
ask. Again, I said too much probably on that for you to summarize. I'm
No,
sorry.
I was just thinking I like that. Like there are so many resources, and I think I sometimes I think about that with trauma too, is like it's hard like going back to the coffee cup. When if my coffee cup is filling up, it sometimes is hard for my brain to remember all the resources that I have access to. And
Yes.
so I think this is so great. It seems so simple. Like why wouldn't we think about this? But I wouldn't have thought of that. Go to Google, you know. It's
Yeah, well,
so great.
yeah, sometimes it's our age too. Like those of us that are under 25, going to Google and YouTube seems to be more natural.
Mm,
Those of us that didn't grow up with it, it wasn't like a tool that we had available for those of us who are super young. I mean, super older now. That's not
yeah.
coming out right. You know what I mean. But you said some things also, I think, that are important that I didn't mention earlier. Other symptoms of trauma are difficulties with sleep and difficulties with food, difficulties taking care of ourselves.
Hmm.
So it is hard to be resourceful when we are not doing those basic self-care things. So before working on a relationship issue, making sure you as an individual are hydrated, eating in a nutritional manner, getting enough rest, And then the last one is some kind of movement. It doesn't have to be running, just, taking those walks, taking those breaks. When you're able to do those four things, you're able to give more to your partner as well. But if you can't take care of your basic needs, it's going to be really hard to be healthy in your relationship.
Yeah, I'm thinking for the spouse too, for the spouse who has not had the trauma experience, there still is kind of like a shock wave in the relationship from the trauma that can be really great if the spouse does that same thing, makes sure that they're eating or sleeping. I'm even thinking like my husband's not a trauma survivor, but he has funky sleep stuff. And there'll be times where like I don't want to go to bed without him, you know, or like I want to be together, so stay up later, or I won't eat until he comes home. But then if he comes home really late, then he just wants a snack, and then I'm like, do I just want a snack? Like, so even though I was just thinking on with when there's trauma, that whole experience is probably like on steroids, so much bigger for the spouse to continue working on their sleep or their health. I'm thinking can also then um
Yes,
help in the relationship as well. So,
absolutely. Hmm.
yeah. Yeah, so I find myself thinking about there's sort of like an individual healing journey when there has been trauma, but there is also like a couple healing journey. And I'm wondering if you have any thoughts about how couples can journey together in in recovery from trauma.
Sure. So my official answer would be couples counseling and
Mhm.
doing there's lots of different interventions, but imago therapy is specifically for couples where there's at least one person with trauma. My unofficial answer is if you're working together as best friends and you see your partner struggling, go grab them their self-care bag. So for trauma survivors I work with, I recommend they all have their self-care bags or notes. And I'm glad I'm saying this too, because I was thinking what you said when our cup is already full and we can't think about our resources. It's helpful to have our resources together, like in
Mhm.
a bag, or for men, I call it the toolbox.
Yeah.
For women, it could be a fancy purse, and you could, no gender issues here. You can use whatever. You can use a plastic bag. It doesn't matter. And then things that won't fit in the bag, you just have stickies or index cards that says Google XYZ, or call this person, or get your weighted blanket off your bed.
Yeah.
Okay. So when you see your partner struggling and you know what works for them, like, oh, they probably had an overwhelming day at work. Maybe I should just go ahead and make them a sandwich. Or say, hey,
Mhm.
are you hungry? Can I get you some tea or drink? Grabbing their self-care bag. We should have things like silly putty and Play-Doh, things for our, the sensory things for our hands, or the stress balls. It could be maybe their favorite comedy show, put that on, or play their favorite tunes. If they have music that kind of energizes, maybe there could be a dance party with the couple,
Uh-huh.
that goes back to that playfulness. So knowing, your partner most likely, right? Most of us know what makes our partner tick. If you don't, ask them, right? Keep
Mhm.
working on that. And then ask yourself, what's one thing I could do for my partner? If I am my partner's best friend, the other idea I have is see the child in your partner. Because when we're wounded, our behavior and how we react can be pretty childlike. Our brain never grows up. Our brains are brats, you know? Our brains like to have fun. Our brains like to be rewarded, no matter if we're 85 years old. So if you think of that little child in your partner, like, okay, what could I do for this little person? And I think our tendency will be a lot more gentle, a lot more nurturing. So there you go.
Yeah.
I think that's the best of what I have.
I think that's a good strategy for the spouse to find empathy. I often
Hmm.
think like one of the things we all need is this sort of empathy, emotional understanding, and support. And if I am struggling to find my empathy, that seems like a really great strategy that the spouse can use to say, okay, how do I see the wound here to have empathy for it? So let me repeat that one. So we've got go to couples counseling. I know you mentioned Imago, but I wanted to also share like there's cognitive behavioral therapy. No, what is it? It's conjoint
Yep.
CBT for
CBT.
PTSD. Yeah, so there's a
Yes.
specific cognitive
Yeah, I forgot
behavioral
about that.
therapy.
Yeah.
Yeah, conjoint cognitive behavioral therapy for
Yeah.
PTSD. You could Google that to find a provider nearby.
I've also had that training. It sounds like you have as well.
Oh,
The
I
co-
do
the co-
emotionally focused. So the
okay.
way that I work is emotionally focused couple therapy, but it does have research to support it with trauma survivors
Hmm.
as
Yep.
well. So, but
Yep.
it's just a different underlying theory.
Hmm.
But they just like Imago is as well. So that but they could all be helpful. They just work on slightly different things.
And it's good to have choices because Imago may not work for everyone. It's okay if you find that something isn't your style. It's research. Like what else is there, and who's a therapist near you or in your state with virtually. Usually you have to have somebody licensed in your state, or they may be licensed in a few states. So it's
Yeah.
good to ask.
Yeah. So therapy that has been shown to help work with couples where one or both has trauma. Of course, there's individual trauma therapy, but when we're thinking about the
Hmm.
relationship, there are specific couple therapies that help couples where one or both have trauma. And then you were sort of saying like, let's be really thoughtful about what our partner needs. Can we help if they're struggling to get resources? Can we help bring the resources to them? In like a shorter summary phrase. Does that sound like I was that an okay summary of what you were sharing?
It's perfect. Beautiful.
Okay. All right. Thanks. Yeah. And I love your resource bag idea. So I don't have to remember all the resources. I just have to remember where's
One
my
place.
place where my resources are.
Hmm. And
Yeah.
work on those resources on a day you feel well. Like you feel like you're thinking clearly. Like, okay, one a bad day. Yeah, maybe my journal should be in this bag. Men like those gripper things too. So,
Oh yeah.
and maybe like if it's your male spouse that's been to combat, maybe the next present for him is a toolbox with all these little, fidgety things or comforting things. Like if he loves beef jerky, put some of that in
Uh-huh.
there. If he has a favorite tea, put some of those tea bags in there. That kind of thing.
Yeah. I like that. Well, I'm curious, do you have any sort of like final tips or takeaways for the listeners?
Oh, I feel like we stuffed this episode with lots of great tips for
I
sure.
agree. Yeah, there's no pressure. You don't have to have any. If I mean, people can just go back and listen to all the tips you did give because you gave so many throughout this episode.
Mhm.
I just wanted to give you a chance if there was anything
I
final you
think,
wanted to say.
sure. I think a helpful tip that I give a lot is having an app on your phone that has something to do with mindfulness or meditation.
Hmm.
Couples that do, restorative yoga or yoga nidra or deep breathing, progressive muscle relaxation, like whatever your favorite is, guided imagery is another. Doing those activities together too really help bring some zen to the relationship. So that's I think another helpful takeaway.
Yeah. Are there any specific apps for on the phone that you tend to recommend?
Mhm. The common free one is Calm. I have a love-hate relationship with that one because I think some of the providers or professionals who do them are corny or too woo-woo for me. I'm fairly woo-woo, but some are like When they say, pretend you're a flower, I get really annoyed. I'm
Uh,
sorry. I am a
that's
survivor
okay.
too. So, an app that I consistently love that is a paid app, it does have a free trial, is Headspace. The monk who does most of the recordings, he has a very soothing voice, and he also kind of is more guided.
Okay.
And then on really bad days, first of all, I think meditation is more prevention than something you do when you're reacting. But on bad days where I still want to do a little meditation, Headspace has kids meditations that are shorter, 2 to 5 minutes. So I'm like, okay, I can do anything for 2 to 5 minutes. And that's what I'll kind of go to when you just need to kind of center yourself more, bring down that distress.
Yeah. I love that. Yeah, I love that. Well, thank you so much for being on this podcast, Karen. I think it is very jam-packed full of a lot of tips that people can take away from this on how couples can navigate together around this healing journey from trauma. Can you just repeat again how people could find you, work with you, learn more about working with you?
So currently for female survivors or people who identify as female, I have a virtual group. It's called healingfromtraumatogether.com. And in this group, it's an accountability group for survivors where we set goals each month on how to work on our foundation, which is ourselves, how to work on improving our relationships, whether that's marriage, parenting, our families of origin, and so forth. And then the other area we work on is our dreaming. What do we want for our futures? So every month I do coaching calls virtually. There's a workbook. Every month has a theme. The workbook has journaling prompts, um, counters or affirmations, a CBT work for the month, and then other exercises. So that currently right now I have that for females only. I do work with a lot of men, so I envision having something similar for men in the future. But I also have coaching services where we can work on communication, conflict resolution, or even just how to be more playful. We can have play sessions for adults. The best way to get me, and if you're not sure what kind of service you want right now, I do have 15-minute consultation calls that are complimentary. The best way to get those is healthrivedream.com.
Yeah, wonderful. And all of those links and the information will be in the show notes in case anyone wants to go just have an easy way to like click and find you. So,
Yes.
yeah. Well, thank you again for being on the podcast.
Thank you so much for having me.
I hope you enjoyed today's episode. If so, please take a second to go rate, review, and subscribe so you get all of our future episodes. Make sure to check out the show notes to sign up for our free 10-week relationship email course. This email course is really designed for people who are maybe having trouble with communication or connection in their relationship and helping them develop some quick wins right away to start improving it. While I am a therapist, this podcast is for educational purposes only and is not considered therapy. And it should also not be a replacement for therapy. If you think you need a professional of any kind, you should definitely go find one. Until next time.